key issue. So the regeneration is important because in most people with diabetes, when they come to see their GP, it's very likely that the neuropathy has already progressed. So doing what's called a prevention study is very unlikely. They're always going to have some level of nerve damage. So you need a drug that can enable those nerve fibers to grow back or to regenerate back to where they were before, in the skin or in the muscle. And we have clear evidence that our drug can do that. And certainly our work, which we're about to submit to a journal, is the first study to show that you can regenerate fibers in an animal model. I mean, it's never been shown before. I mean, everyone has done prevention studies where you have an animal, you make it diabetic, and then you start treating it straight away with a drug, which is nice for screening drugs, but it's not relevant in terms of the human situation, because that will hardly ever happen, certainly not in diabetes. This is the problem with the disease, and it's an insidious disease because you're dealing with sensation, and obviously some patients get pain. Okay, and so then they go to see their GP, and early on in that case, you might be able to solve the problem. In the majority of cases of people with neuropathy and diabetes, it's an insidious disease that creeps up on them. And then all of a sudden, they go to their GP and complaining that they've got ulcers, and they put their hand on the hot plate yesterday and didn't feel it. And by then, it's quite often too late, because that means that all the nerve fibers that are required for that sensation have died. So that is somebody that we would want to target with our drug at some point. With regard to some other diseases, that it might be simpler. For example, people who are on an anti-cancer drug, we could actually give them our drug before they go on the anti-cancer drug. So you can do a prevention study there. And we are trying to develop some protocols to move that area forward. It might actually be easier for us to get our drug through clinical trials to do with cancer treatment. And then the advantage of that will be that diabetic patients could use it off-label. That's another plan that we have.